Hi, I'm Dr. B, Psychiatric Nurse Practitioner, and today I'm going to be talking about fear and anxiety. So my patients don't like me when it comes to this. Oftentimes I will have someone tell me, I am afraid of flying, going to the store, driving the car, and they want validation. They want me to say, okay, you're afraid of that. It's a disorder. There's nothing you can do about it. That is so not true. You have control of your anxiety. You have the ability to face, manage, and overcome any fear that you have, even if that fear is based on a reality. We have so many people who have legitimate fears based on past trauma, right? If you were violently attacked, you are going to be more afraid of being violently attacked again, correct? But what I want to do is empower you. That's what this is about. Mentally strong is about teaching that mental strength that we all want, but no one's actually out there teaching it. And so what I want to tell you today, there's a specific therapy that we call systematic desensitization, okay? But you can do this yourself. You take your fear and you learn to face it. So we have a choice opportunity, and there's a link below that you can download this choice opportunity for free. But it's basically logging those fears, showing the anxiety that it produces, but then facing those fears. And the more often you face the fear, the easier it is to face the fear. So I have so many patients, and I just kind of want to say, stop. Stop doing this to yourself. Stop ruminating on those fears. Stop avoiding your fear, because the more you avoid it and ruminate on what bad could happen, the more this is going to impede your function, right? So if you are afraid of going to the store, and maybe you've even been diagnosed with social anxiety disorder, I encourage you to get treatment, because sometimes when we are prone to depression and anxiety, there's actually low neurotransmission going on in the brain. So it's harder to make these choices to face those fears, okay? So get treatment, but don't stop there. Don't own that diagnosis as if you now no longer should have to go to the store, or only go to the store when no one is there. If you are, let's just go with the whole social anxiety. If that is a real thing for you, whatever your fear is, replace it. As I tell this, face that fear and do it in small increments. So let's say social anxiety is your fear, and you typically, now with the COVID, it's real easy to do. Now you do Instacart. You don't have to go to the store anymore. I challenge you, if it is safe, to start going to the store. You can start going when, maybe during hours where there's not a lot of people, and continue to do that and face that. And then when that becomes a little more comfortable, don't stay there. Challenge yourself to that next level. Challenge yourself to find and go out with friends and have a social outing. Whatever your fear is, identify it. Give it a number, like anxiety scale, okay? So for example, prior to going out socially, let's say you scale it from 0 to 10, and you say it's an 8. And then you challenge yourself, I'm going to do this weekly, maybe twice a week. And then that anxiety goes down to a 5 or 6. Now it's time to up the ante and do something that's a little more challenging, so that you can get control of this fear. So the moral of the story is, your fears, you can control those fears, and you can manage them, and you can overcome them. So fear paralyzes you. It decreases your ability to function at your maximum capacity, right? So that's my little pet peeve on fear. And I challenge you, I hope that I've challenged you to identify what your fears are and make a plan to expose yourself to those fears until the anxiety of that is less than 5. Okay, so that is your goal. So if you know someone who struggles with anxiety and fear, share this video. Subscribe. We talk each week about little things that can help us learn to be mentally strong. That's the whole purpose of this channel. And remember that you too are mentally strong.